Well, India has crossed 53 lakh COVID cases with the surge of over 95,000 cases for the last 2 days, while Maharashtra is still the worst hit with a rise of over 21,000 cases in 24 hours. Delhi isn't far behind. The nation's capital has seen a surge of over 4,000 daily cases, which has now resulted in an acute shortage of ICU beds in many private hospitals.
The family of 77-year-old Badrinath, a resident of Dilshad Garden in Delhi, had to run from pillar to post after he tested positive for COVID and his oxygen saturation dropped. After hours and hours of struggle, the family managed an ICU bed for him in the Delhi government's Rajiv Gandhi Hospital.
उन्हें अपनी गाड़ी में लेकर हॉस्पिटल टू हॉस्पिटल घूम रहे हैं, लेकिन हमें बेड नहीं मिले. हम उन्हें यशोदा लेके गए, मैक्स लेके गए, इवन गंगाराम तक में पता किया, लेकिन हमें वहाँ पे आईसीयू बेड्स नहीं मिले. हमें राजीव गांधी सुपर स्पेशलिटी हॉस्पिटल दिलशाद गार्डन में एक बेड मिला.
According to the Delhi government's Corona app, while ICU beds are available in Delhi government hospitals, there are no ICU beds available in the capital's top government hospital, the All India Institute of Medical Sciences. All major private hospitals are left with no ICU beds. According to doctors, there is an increase of 4% in patients admitted to the ICU in the past 10 days in government hospitals. The Delhi government is now increasing the number of ICU beds in private hospitals.
The number of admission just a day before, it was 34 in a day, which came down to less than 5-6 per day. In the same ratio, the ICU admission has gone up. Our ICU, which was catering nearly 8, 7, 9, 10 patients, now it is full again. We have to increase the ICU bed.
पिछले 5 दिन के अंदर 500 ICU बेड बढ़ाए गए प्राइवेट के अंदर ही.
The situation in Mumbai, the capital of Maharashtra, a state which is worst hit so far, is no better, according to BMC data. Only 2,886 oxygen beds are available out of a total of 8,805 beds, while only 114 ventilator beds remain out of a total of 1,119 beds.
People who have money, they want their patient to be treated in private hospitals like Max, Fortis, Batra. That is the reason there are no ICU beds available in these private hospitals. In fact, in Delhi AIIMS, which is the biggest government hospital of the country, they also don't have ICU beds available. That is the reason the state government of Delhi is emphasizing in increasing ICU beds in government hospitals as well as private hospitals. In New Delhi, with Ashok Mahale, Saurabh Shukla for NDTV.
All right, so that situation in private hospitals looking after COVID patients is fairly critical at this stage. Joining us also some government hospitals and not least of all AIIMS, the largest hospital in the country. Dr. Anjan Trika, Chairman of Clinical Management at the Group COVID Center at AIIMS, Dr. Suranjit Chatterjee, the Senior Consultant of Internal Medicine at Apollo, and Dr. Vivek Nangia of Max Saket, Principal Director and Head of Respiratory Critical Care. I'd like to thank you all very much for joining us. Dr. Trika, we spoke yesterday as well, and the situation in terms of the numbers of ICU beds was it was difficult for you. What is the situation at the moment?
Well, we've changed our strategies. We have made more ICU beds. We are converting our HDU high dependency unit beds to ICU beds, and some wards to HDU beds, and we are shifting milder cases to Jhajjar so that we can take care of the largest number of people who come to us. Yesterday itself, we were able to get in about 26 patients. We were able to discharge about 16 patients and transfer about 3 patients to the non-COVID areas, which we have also running in the main hospital building. So things are tough, but they are not yet unmanageable.
Okay. Dr. Nangia, do you have any ICU beds available right now for COVID patients?
Well, Vishnu, unfortunately, yes, you're right. We don't have any ICU beds available. We, in fact, don't even have the hospital beds available right now. We're really running short of beds, despite the fact that we've increased our capacity. As per the Delhi government guidelines, we've made 80%, at least not 80%, but 60-70% additional beds have been created in the hospital. Yet, we are not able to meet the demand. But what we've started doing now is prioritizing our patients. We're not admitting everybody left, right, and center, whoever is walking in. We're using a certain criteria that only if somebody is sick, requires oxygen, or the blood parameters are haywire, CT scan is showing a mild to moderate degree of infection, only then are we admitting them, otherwise not. So that's only to save the ICU beds.
Dr. Chatterjee, what about Apollo? Do you have any ICU beds for COVID patients presently?
We really don't have any ICU beds right now, and we're really juggling up the patients from one treating center to the other. We have created a high dependency unit, which is like a semi-ICU, where as soon as the patients get stabilized in the ICU, we are trying to transfer them to a high dependency that we have created as a new ward, because the number of patients, and that too also coming from outside, are really sick at this moment. And unfortunately, as I said yesterday also, that the patients have become slightly more sick now as compared to what they were about 3 months back. And they're mostly requiring oxygen. They're requiring the latest treatments that we are not now following. So we are also juggling with the ICU beds at this moment. We're really struggling at this moment.
As we continue this discussion, I just want to point out to our viewers, because our intention is not to create some sort of panic. There are ICU beds which are available in government hospitals in Delhi. Several hundred of them presently are available. I think what we are talking about on this program, by and large, is that all hospitals are increasingly under stress. And yes, Apollo and Max, among several private hospitals in Delhi, have 0 ICU beds. And I think at AIIMS, there's a lot of juggling which is going on right now. Dr. Trikha, it's one thing if you speak about ICU beds, and just as a point of clarification, when you say ICU beds, are you talking about ICU beds with ventilator support, or are you talking about ICU beds without necessarily having a ventilator? The question is there a shortage of ventilators as well?
Thank you, Vishnu. I think it was so nice of you to put the panic at rest when we spoke, because I thought a panic would be created. When I talk about ICU beds, I talk about the ICU bed which has a ventilator, which has something which we use before the ventilator, which is a high flow nasal oxygen device, or a NIV, which is non-invasive ventilation, and that's what we talk about. When we talk about an ICU bed, we talk about ICU bed in totality. And if you talk about only oxygen being given by different devices, which will vary from a rate of 2 liters per minute to about 10 liters per minute, that would be available on all our beds in our COVID center. So not a single bed would be without oxygen.
Okay. And Dr. Trikha, in terms of stepping up your capacity, it's not just the physical presence of beds that depends on the area available, your infrastructure available. It also has a lot to do with your doctor availability, medical staff availability. How much of a concern is that your best practitioners are deployed at a time when you need them?
Yes, I think that's the crux of the whole problem. You can buy ventilators, you can get the beds, you can get the monitors, but you need manpower. From manpower, I need a consultant or a faculty member to the person who's taking care of the sanitation. Everybody is required. And what we are doing is, we have asked from the non-COVID area, or about 50% of resident strength and 40% of faculty strength to be posted to the COVID area now. We are extending the number of beds to a separate building also, which is the burns and the plastic building. We would be commissioning about 60 more beds, and that would take care of a lot of patients. So we have a plan B, and we were anticipating that a second surge will come, and it's nearly ready. So things are stretched, but things are not out of hand for us.
Dr. Chatterjee, is this not community spread? I mean, it used to be a bad word. It still is. Let's face it, but that's where we are at, right? We don't know what's happening, where people are getting infected. Dr. Chatterjee, you want to take that?
No, your voice broke in between. Sorry, your voice broke in between. I couldn't get your question.
Are we in the middle of community spread in Delhi, in the NCR?
See, this community spread, there is obviously a type of community spread which is localized. I would not say that there is a widespread community spread, because once there is a widespread community spread, that means anybody and everybody who is coming to, suppose, Apollo or to Max or to AIIMS would get infected if there is that much of infection spreading in the air and all these things. So there is obviously a localized community spread. I would agree to that fact, but it's not a generalized community spread. But yes, the way the numbers are increasing, there has to be a bit of community spread that is happening in the country.
Dr. Nangia, when a person falls unwell, and just spread the message here for viewers, right? They've tested positive, or even if they've not tested positive for COVID, they've got symptoms, clear symptoms, they need to get to a hospital. It could be COVID. what do they do first? They look up an app, or do they just rush to your hospital? Because if you don't have hospital beds for COVID patients available, Dr. Chatterjee doesn't have, Dr. Trika is running out of beds at this stage, then how does a patient who needs help know where to go?
That's a very valid question, Vishnu, that you've asked me. I would want to actually, through your medium, tell the public at large that although we, all our messages so far have been keep your face covered, wear a mask, hand hygiene, social distancing, but we haven't really educated our public that if they have fever, first of all, they don't need to move out of the house. This is very, very essential. What is happening now is that people with 3 days fever, 4 days fever, cough, sore throat, they're just roaming around, considering it to be a usual viral illness, because this is also that time of the year when people would develop allergies and coughs and colds. As a result, what is happening is that there is so much of spread happening because of these people who are carrying the disease and roaming around. It's not uncommon these days to have patients coming into our hospital in the OPDs, walking in with fever for 4-5 days and just saying, oh, it's just a mild sore throat, doc. It could be a viral. I usually have a viral at this time. And you get their COVID tested, it turns out to be positive. We don't realize that they would have infected so many people, right from the front office staff to the billing to the reception, and then the doctors themselves. So the message that has to go out very loud and clear now is that anybody who has fever, sore throat, loose motions, body aches, the first thing that they should do is isolate themselves. Contact their doctors, start their treatment at home. Do not delay the treatment. So there is also a sense of denial in our patients. They still say, no, doc, it may not be COVID. Why do you want to think of COVID? They're not realizing that this is a time where anything can be COVID and nothing can be COVID. So we have to have that index of suspicion very high. Every patient with fever should be considered as COVID unless proven otherwise.
Okay. Dr.
And
Trika,
that is the main reason that we must investigate them right at the onset.
Dr. Trika, running short on time, we've spread this message, but you were telling me something worrying yesterday, that you have a lot of patients who've been there for a long time, and that in this second wave you're seeing that, patients who've been there for several weeks in hospital. Why is this happening? Is there an underlying medical, you'll say comorbidities, but we've had comorbidities earlier on as well. For some reason, is the duration of a lot of very sick people increasing in your hospital?
Yes, that's happening, I think, across hospitals. The number of people with comorbidities is increasing, and they are staying in the hospital for a longer time. This is not unnatural or unnormal, but then we are seeing that they get sick, they have a renal failure or a liver disease, and they stay in the hospital for a longer time. So when these people are there for a longer time, we can't get in fresh patients coming in. And then if, let's say, somebody who needs a dialysis, he cannot be discharged unless he becomes negative, because he cannot get a dialysis done from any other setup unless he becomes a negative person. So these are the kind of people who are there with us for a longer time. We're trying to shift them to Jhajjar, where they'll be more comfortable and they can give space to slightly more critical patients. And what the earlier doctor has said is the bottom line. We will have to we'll have to stop spreading this virus. The government did its lockdown. Now it is the time of the citizens of Delhi to do a self-lockdown. Please don't go out unless necessary. Do go out. The economy has to run. But please don't party. Please don't go to each other's house.
Right.
And that's the way we'll fight it out.
I'd like to thank all of you very much for joining us and spreading that message. We'll continue to do that. Thank you very much indeed.
Thank you, Vishnu.